My name's Harry Reynolds, and I'm a general surgeon here at Harney. Previously at University Hospitals of Cleveland. I did my training there 30-some years ago. So went to med school in Cleveland at Case Western Reserve, and I met my wife in med school, and so we stayed in Cleveland. Both did our residencies there. She did OB/GYN, I did general surgery, and then I had a military commitment, so I did 4 years of active duty with the Air Force, and went off to Kansas for 4 years, and then came back to Cleveland, trained in general surgery and colorectal surgery, and I did a colorectal fellowship at the Cleveland Clinic 95, 96, and then following that, worked briefly at Kaiser and the Cleveland Clinic for a few months, and then went back over to where I trained initially at University Hospitals, and been there until the end of September of last year. And so I kind of had an odd path. I started out in forest engineering. That was my major. My dad was an engineer. I was always interested in engineering, and then I always enjoyed the outdoors, so it seemed like a good combination. I had a summer job in Ohio working at a small hospital. My mom was a volunteer at the hospital, and we just had a summer job, so I got a job working as basically just an orderly at the hospital. I worked in the operating room and transported patients back and forth to the OR, and then when they needed help in the operating room, I actually scrubbed in and helped on cases. So, got to know the chief of surgery there really well. He got me interested in surgery, and because I wasn't going to do it, and then he kind of talked me into it. And so I switched into bioengineering at Syracuse University. I finished as a bioengineer, and then I went to med school. So I enjoyed colorectal surgery as a resident, and kind of wanted to subspecialize a bit and do more GI surgery. So had in Cleveland, predominantly I did colon and rectal cancer surgery. I did inflammatory bowel disease, colorectal cancer. Most of my practice was based upon complex rectal cancers and complex pelvic surgery. So I did a lot of reoperative pelvic surgery, and for many years I was the director of colorectal cancer surgery there at University Hospitals. And so after I did 4 years of active duty, I came back to Cleveland. I did my colorectal fellowship. I joined the Air National Guard, the 180th Fighter Wing in Toledo. So I've been in the same unit now since 1995, and been all over the world with the unit. I'm a flight surgeon and a general surgeon. So for the Guard, as a flight surgeon, what we do is we take care of the flyers, make sure they're prepared to fly, ready to fly, optimize them for flying, and we also get to fly with them. So the best of both worlds. You get to fly a bit, and you get to practice medicine and work with a great group of folks. My wife worked with Lad Shaner, who's one of the nurse anesthetists here, and Lad had been coming out here for almost a year and told us about an opportunity. It was just one of those things that seemed to be what needed to happen. Kind of wanted to do something different and slow down a little bit and just come out west. So it's been very nice. The people are super. The community's been totally welcoming. Staff here is great, and it's a beautiful area. I love the Pacific Northwest. I do a lot of hiking and do a little bit of climbing, and I'm just sort of an outdoors guy, and so this is like perfect.